I want to give a warm welcome to our speaker of second session, Dr. Kuldeep from National Sports University in Manipur. So, participants, this will be a very informative session regarding sports psychology. Sir, I request you to continue the session, please.
Thank you, Dr. Mukesh. Good morning, everyone. So, I
Good
welcome
morning, sir.
you in my.
Good morning, sir.
Uh,
Good
uh,
morning.
so, before we start, I just want to know like, do you want me to be dual language or English will be fine for everyone?
Sir, bilingual.
Both
Bilingual. Okay.
language, sir.
Yes.
ठीक है चलिए. So this topic is very close to my heart and sports and as a sports psychology student also I have observed this that this is one of the important topic we do not talk much about in the field. Most of us generally focuses on the training part or the physical abilities part, and we generally ignore the mental health part. I'm not talking about psychological. Yes, we have been giving importance to psychology also, but कहीं ना कहीं ये जो mental health का aspect है sports में अभी भी थोड़ा सा दूर रहा है. So I'm going to share my PPT with you. Is it visible?
Yes, sir.
Yes, sir.
Yes, sir. Visible. Yes, sir.
Okay. So we'll talk about little bit in detail this session. And बीच में भी अगर आप सवाल पूछना चाहते हैं तो you are free to ask me anything. So सबसे पहले तो we'll talk about why do we need to talk about mental health. So there is this session will be more of information as well as little bit of statistical detail also. So if you can see in 2019, this is by WHO, one in every 8 person living with a mental disorder. Among that, anxiety and depressive disorders are most common. तो ये एक बहुत important data था, which was a baseline for mental health disorders. Now, as we all know, due to this COVID-19, बहुत से चेंजेस आए हैं. सो उस मेंटल हेल्थ इश्यूज में भी चेंजेस आए हैं जिसकी वजह से 26 to 28% एंजाइटी एंड डिप्रेसिव डिसऑर्डर्स में बढ़ोतरी हुई थी. But when we talk about this in terms of sports, we generally say that okay, because you are doing physical training, you are doing exercises, you are not prone to mental health issues. जो कि physical activity or sports helps in recovering from mental health disease, mental health issues, but it is not give you immunity. It does not give you immunity. So we generally term these athletes as superhuman being, with जिनके पास unfathomable willpower, has speed, strength, skills, and abilities that mere mortal can only aspire to. So we generally consider them beyond normal population because they are athletes, so they become superhuman. Is it correct? So if we go to the this IOC mental health on elite athletes toolkit which was published in 2021, तो इसमें बताया गया कि 33.6% ऑफ एलीट एथलीट. मैं डिटेल दोनों ही दूंगा. सबसे पहले हम एलीट एथलीट्स की बात करते हैं बिकॉज इफ यू कैन इमेजिन द प्रेशर दे आर हैंडलिंग. तो इनिशियली जो स्टेज में हमें अगर सपोर्ट देना पड़े तो वो कितना बेनिफिट होगा इनके लिए. So 33.6% of elite athletes and 26.4% of former athletes reported symptom of anxiety, depression as per 2019 meta-analysis. 49% of the Olympic athletes would be classified as poor sleeper. This is one of the biggest reason of mental health, and male athletes have a lesser depressive or anxiety prevalence as compared to females. This is the data of IOC, International Olympic Committee. अब मेंटल हेल्थ की जब बात करते हैं तो देयर इज अ स्टिग्मा अराउंड मेंटल हेल्थ in general, especially when we talk about Indian society, but as well as in sports also. हम अपने आसपास देखें तो we don't find a lot of people talking about mental health issues, and we don't generally go to psychiatrist or psychologist for mental health issues. We generally tend to develop our own coping mechanism. So सबसे पहले तो जो first initial aspect is there is a lack of recognition. So it's very difficult to spot mental health issues. आसान नहीं है spot कर पाने, because ये कोई एक्सरे एमआरआई की तरह टेस्ट करके या ब्लड टेस्ट करके पता नहीं चलेगा. डिप्रेशन के सिम्टम्स को आप एमआरआई या एक्सरे से टेस्ट नहीं कर सकते. सो देयर इज, एंड सेकंड इज देयर इज अ रिफ्यूजल टू एक्नॉलेज द प्रॉब्लम. Some coaches do not want to lose their top performer or face the fact that they could contribute to their team's mental health. That is also very important. Sometimes it becomes difficult for a coach और a physical education teacher also. जब आपके पास अच्छे एथलीट हो जाए तो आप जनरली एक्नॉलेज नहीं करते हो अगर उनके पास उनकी कोई प्रॉब्लम चल रही हो. एंड देन a lack of psychological safety, which is very important. एक एथलीट जब एथलीट बनता है तो उसके साथ बहुत से लोगों का सपोर्ट जुड़ा होता है, इंक्लूडिंग कोचेस, इंक्लूडिंग टीचर्स, इंक्लूडिंग फैमिली. सो नॉट ओनली दैट, बट उसका अपना पीयर भी होता है एक एथलीट का. इन दैट पीयर दे फाइंड इट वेरी डिफिकल्ट टू शेयर, और उनको लगता है कि अगर उन्होंने शेयर किया तो उनके साथ क्या होगा. सो दे the lack of safety is there. मतलब आप फील नहीं करोगे शेयर करते हुए. That is one of the issues, that there is a stigma and fear of failure and disappointing others. That is, जैसे मैंने पहले भी बोला कि coaches भी involved हैं, teachers भी involved हैं, family वाले भी involved हैं. Now sponsors are getting now in the picture. So all these things matter. All these things matter for an athlete. इसीलिए उनको लगता है कि अगर मैंने बात करी इस बारे में या मैंने शेयर भी किया तो शायद वो डिसअपॉइंट फील करेंगे. सो इस वजह से कहीं ना कहीं ये स्टिग्मा अभी भी हमारी कम्युनिटी में है. अब मैं कुछ एग्जांपल्स देना चाहता हूँ. लेट विल स्टार्ट विद लाइक फॉरेन एग्जांपल्स. आई होप अभी तक जो बोला है वो समझ आया होगा.
यस सर.
ओके. क्योंकि मेरे को थोड़ा सा आई फाइंड इट डिफिकल्ट ऑन गूगल मीट बिकॉज आई कांट सी एनीबॉडीज फेस और एनीथिंग. आई एम जस्ट सीइंग माय पीपीटी, सो आई एम नॉट वेरी श्योर कि कैसा जा रहा होगा ये. एनीवे, सो ये कुछ एग्जांपल्स हैं आई विल शेयर. मैं थोड़ा सा डिटेल में ये एग्जांपल शेयर करना चाहूंगा ताकि आप सब लोग, बिकॉज यू आर अमंग दोज पीपल हु विल डील विद एथलीट्स, और आप कॉलेजेस में, यूनिवर्सिटीज में एथलीट से डील करते हो, अपने डिपार्टमेंट में आप एथलीट्स को देखते हो. आपके कुछ एथलीट्स कोचेस भी बनेंगे जाके, कुछ स्टूडेंट्स आपके कोचेस भी बनेंगे, तो उनके लिए भी जानना जरूरी है. एंड फॉर यू आल्सो इट इज इम्पोर्टेंट टू नो कि दिखता कैसे है. बात कोई करे तो कैसे बात करेगा. यू नीड टू फाइंड आउट दैट एस्पेक्ट. सो देयर आर टॉक अबाउट इट. So जैसे एक MMA फाइटर है रोंडा राउजी. She revealed that she had once contemplated suicide during a period of depression that lasted 2 years. So during her depression period, she thought that committing suicide is a very easy way. And even this footballer Italian footballer, revealed in his book that he saw a psychologist to overcome depression between December 2003 and June 2004. Same with Sarah Taylor, who is a very good female cricketer of England and world champion boxer Oscar De La Hoya, Jonathan Trott, who is also a cricketer, Maninder Singh, Indian commentator, uh, and then Marcus Trescothick. So these are few examples जिन्होंने मेंटल हेल्थ के अपने एक्सपीरियंसेस के बारे में बात करी है कि उनको जब हुआ था तो कैसा फील हुआ था. इसके अलावा भी बहुत से एग्जांपल हैं, जैसे दिस mental health in sports issue topic has become very popular after this 2020 Tokyo Olympic. इसकी शुरुआत हुई थी विद दिस गर्ल साइमन बाइल्स की एक पोस्ट से, जिसने पोस्ट एंड डिसीजन से आई होप ये सबको पता भी होगा इसके बारे में दैट शी इज अ फोर्थ लाइक शी हैज 4 gold, 1 silver and 2 bronzes in Olympic. And just look at the post she posted before pulling out from the ओलंपिक. इन बिटवीन, मतलब वहां पे पहुंच के टोक्यो में जाके उसने बोला कि आई कांट प्ले, बट शी केम बैक लेटर ऑन काफी टाइम के बाद. सो दिस इज वन पोस्ट शी पोस्टेड दैट आई फील एट टाइम्स people forget that even the very best in the world are still human with heart, nerves, pain, stress, anxiety, pressure. So let's continue to spread our love and support. So she was sharing her experience, her own emotions, and people have given different reaction to that. So जैसे look at the second comment on the Twitter post that Simon Biles, the American disappointment. ये एक रियल सिचुएशन है जिसमें लोगों ने क्या जवाब दिया इसकी ओपन अप होने पे. लाइक दिस फोर्थ कमेंट आप एक बार पढ़ना जरा. एग्री विद दिस, सॉरी दैट साइमन बाइल्स इज स्ट्रगलिंग मेंटली, but in the middle of competition, that's terrible. And the USC team lost gold. Russia, here is a gold, you are welcome. तो उनको एथलीट की मेंटल हेल्थ का कोई इशू ये नहीं लगा कि इज इट इम्पोर्टेंट टू टॉक, एंड अगर उसने ओपन अप किया है तो हमें सपोर्ट करनी चाहिए. उनके लिए गोल्ड जीतना है वाज मोर इम्पोर्टेंट देन एनीथिंग एल्स. लाइक सपोर्ट में आप अगर देखोगे तो जैसे ये एलन डिजेनरेस बहुत पॉपुलर नेम है यूएस में. शी ट्वीटेड दैट you are solid gold in my book. So people supported them and people were disappointed also. ये एक बहुत बड़ा रीजन है कि एथलीट्स बात नहीं करते हैं मेंटल हेल्थ के बारे में, या हम एज ए फिजिकल एजुकेशन टीचर, एज ए कोचेस, वी डोंट टॉक अबाउट दिस मच. This was also very popular incidents in terms of the debate of whether mental health is important or not, or is it correct time to talk about it or not. So ये एक Japanese tennis player है, Naomi Osaka, which had quit French Open in 2018 because she was suffering. 2019 में I think she left. So she was suffering from depression since 2018. She refused to come to the conference, जो press conferences होती हैं इन athletes की, जहाँ पे जाके अपने like before match and after match they answer questions of these journalists. So in some competitions it is mandatory, like in tennis it is mandatory to talk to the reporters. अब उसके साथ हुआ क्या? She refused to attend the post-match conference, and she was fined 15,000 US dollars. कि आप आइए, आप कॉन्फ्रेंस, इवन इफ यू आर नॉट फीलिंग वेल, इवन इफ यू आर नॉट ओके, यू हैव टू कम. इस पे भी लोगों ने डिफरेंट व्यूज दिए. लाइक मार्टिना नवरितोला तिलोवा said that I am so sad that about Osaka. I truly hope she will be okay. As athlete, we are taught to take care of our body, and perhaps the mental and emotional aspects get short shift. This is about more than doing or not doing a press conference. This is a very supportive uh, tweet, but Novak Djokovic ने क्या respond दिया that I understand that press conferences sometimes can be very unpleasant, and it's not something that you enjoy always, especially if you lose a match or something like this. But it is part of sport and part of your life on the tour. This is something we have to do. Otherwise, we will get fined. So, because of the fear of, like, it shows the mentality that because you will get fined, you have to attend something which you really don't want to attend. हमारे विराट कोहली ने भी एक सबैटिकल ब्रेक लिया था इन बिटवीन एशिया कप. He said that I'm not shy to admit that I was feeling mentally down. For the first time in 10 years, I didn't touch my bat for a month. I came to realize that I was trying to fake my intensity a bit recently. I was convincing myself that no, you had the intensity, but your body was telling you to stop. The mind was telling me to take a break and step back. This is one thing. Just imagine Virat Kohli saying that felt like I was the loneliest guy in the world because of his episode of depression. Ben Stokes इंग्लिश क्रिकेटर है, बहुत पॉपुलर. He also had an episode of this mental health issue or depression, you may call it. He said that I was in a real dark place and having something difficult thoughts. Having some difficult thoughts. I was always one of those players who wouldn't talk about how they are feeling and just keep it internal and crack on. I realized talking is such a powerful thing, and it has completely changed me. He also took a break, and then recently this boy Noah Lyles, who is a 2019 world champion and 2020 Olympic bronze medalist and 2022 world champion in 200 meter, he said that recently I decided to get on antidepressant medicines. That was one of the best decisions I have made in a while. Since then, I have been able to think without the dark undertone in the mind of nothing matters. माइकल फेलप की एग्जांपल ले लीजिए आप. बिफोर ही बिकेम चैंपियन इन 2008 बीजिंग ओलंपिक, he was in depression. Sania Mirza, who just retired from a very excellent career in tennis, after her injury, she found herself in depression. Serena Williams, one of the best athlete in the world, also felt it. Glenn Maxwell, in England, this Australian cricketer, has also felt it. Now, what is the Indian scenario? This is a journal data which was this is a research which was conducted by National Institute of Mental Health in Bangalore. They did a survey from 1990 to 2017. This was the prevalence which they found. And why this becomes important is, like, any field, people from sports are from the same background or same places where the general population comes from. So if general population has mental health issues, there are chances that it will be with the sports athlete or athletes also. So if you can see the southern belt of South Indian belt has a very huge percentage of people who are in depression, and northern part is still middle is still okay, but this southern part is high, has high prevalence. And anxiety disorder also, if you will find it that it's very like it's a huge number in terms of population. uh, in between, I want to ask you, how many of you feel that in sports we have a lot of people who have talked about this, and in India, I'm talking about in generally, like people have talked about this, people have thought about this and shared their views also. Because I will share you some of the views also. Can anybody
कुलदीप
give me
सर,
examples? Yes.
कुलदीप सर प्लीज, प्रेजेंटेशन नहीं है सर, गायब हो गई, देखना।
नहीं नहीं, मैंने अभी बंद करी है ताकि मैं देख सकूं। आई जस्ट वांट टू नो कि इंडिया में ये स्पोर्ट्स में कितने लोगों ने शेयर किया होगा। आपको क्या लगता है कि हमें भी प्रॉब्लम है? विराट कोहली इज एन एक्सेप्शन, बट अदर देन दैट।
जी सर।
ओके, चलो, let's keep this at the end of the session, if it is difficult for you to share. So I'll share the PPT again, and I'll take the questions afterwards. Okay. So this is the data by National Institute of Mental Health, and let's see this headlines of last year. 4 shooters in different regions. 3 were from Punjab, 1 from Kolkata, died by suicide in 2021. They were aged between 17 to 28. And just imagine, one of the best Olympian athlete we had produced is Abhinav Bindra. This is his interview by this I'm forgetting the name, but this channel was the Mind Matters. On this, he was talking about his like what did he feel about afterwards, उसको कैसा लगा जीतने के बाद, ये सारी चीजें उसने शेयर करी, तो it was very interesting to listen. So this is one thing which he shared, that when he was like he practiced, his focus was 16 year he focused for this gold when he won in 2008 to this Beijing Olympic. So he said that मेरे को जीतने के लिए सब लगे, बट उसके बाद क्या हुआ, that I want to share. So he said that one fine day, this dream, which he had, kindly mute yourself because it's disturbing. Okay, so after his Olympic gold, he said that after this, the dream which I had was achieved, but it created a very large void in my life. I think that's to me was very challenging. I was depressed and I was really lost. I did not know what to do with my life. That was probably the toughest moment of my life. So just imagine an elite athlete who won gold medal in Olympic, which is every athlete's dream, felt so bad after winning the medal. So he also shared this, that my energies were depleted. It took a lot out of me to win, but more than anything, when you are goalless, you are listless in your life. The beauty of having a goal in life is that it drives you, and when that is lost, you lose a lot of meaning in life. Sometimes we'll get lured by an equation that gold medal equals happiness, which is very important to understand. हम सब लोगों को ये जानना जरूरी है that is winning everything. So just imagine an Olympic champion saying something like this, that uh, the gold medal equals happiness, which according to him is false. We need to reverse the equation and make it as happiness equals gold medal. Look at Rani Rampal, Indian hockey captain, said that there would be nights I would just cry not knowing why. So this is, even the athlete do not know what is happening to them when it comes to mental health issue. Joydeep Karmakar, um, Commonwealth medalist, common Olympian, and he is the Indian Rifle shooting chief coach right now, said that we treat athletes like racehorses. We can see injury on the outside and limping player, a bleeding boxer, but the scars inside are not visible. We want them to run and jump for us, win medals, and then we dump them. How many of us walk up to an athlete and not ask the speed or the kilometers, but just hug him or her and ask, "How are you today?" This is one of the most important aspect which I have seen in this recent days. After he became uh, chief coach, he hired sports psychology team for national camper. Two of our students are there now, and the debacle which was in 2020, because we all had hopes from shooting team in Tokyo Olympics, but they disappointed us. And this is how the chief coach, now chief coach, has reacted on it. Even Vinesh Fogart said that when you share something for mental health, uh, like I have mental health issues, इतना बोलना मतलब आपके लिए स्पोर्ट्स खत्म ही समझो. So federations or people in the system will be the first one to say that if they are not mentally strong, why did you send this person? And our Indian football team goalkeeper Gurpreet Sandhu also said that um, why? Because the atmosphere created around athleticism and athletes, and how steel-minded and emotionless and pain-free they should be. This is what we expect our athletes to be. This is what we expect our sports person to be, that they should be steel-minded, emotionless and pain-free. जब ये नहीं होता है कि एथलीट को लगता है कि आई एम नॉट स्टील माइंडेड, आई एम नॉट इमोशनलेस, आई एम नॉट पेन फ्री, दे फाइंड इट वेरी डिफिकल्ट टू रिलेट. दे फाइंड इट, अब क्या करें. Olympic bronze medalist Sakshi Malik also said this, that while thinking of consulting a sports psychologist, I used to think that what do I tell them, that I am weak. This is also one issue which I like, which I find that it's very important for us to know that when an athlete approaches you for their mental health issues, that doesn't mean that the athlete is weak. So the image of athleticism which we need to revisit that image or definition. Even badminton star HS Pranay also said that whenever you say that you need to talk to a professional people think that you are mentally unstable. So this is true. इंडिया में कभी भी कोई कहे कि मुझे थोड़ी मेंटल किसी से बात करनी है, So generally we say that अरे पागल तो नहीं है, you are not like mentally unstable is the word which we use for people who talk about mental health. Just imagine India has the like the richest cricket board in the world, and still we did not have team psychologist or a psychologist with BCCI cricket, this women cricket team. Indian this captain has to, Harmanpreet has to urge the BCCI to appoint a psychologist. This is again Ben Stokes. Now this is this now furthermore this topic is, people find it controversial that how can sports compromise mental health. This is what, if you have like I have already shared the views of people, मैंने जो लोगों ने पहले बोला है कि इतने एलीट एथलीट लेजेंड्स ने बात कही है कि मेंटल हेल्थ बहुत इंपॉर्टेंट इशू है और हम वो खुद फेस कर चुके हैं, तो कहीं ना कहीं दिस हैज टू बी, दिस नोशन हैज टू गो दैट sports leads to a only healthy lifestyle. If you are a professional sports person, that is a different field than just a healthy exercise enthusiast. ये एक रिसर्च थी जिसमें like they have found that मेटा एनालिसिस करने के बाद दैट ओवर ट्रेनिंग, स्पोर्ट्स में ओवर ट्रेनिंग की वजह से देयर आर चांसेस ऑफ मेंटल हेल्थ इश्यूज 20-60% बढ़ जाते हैं. इंजरीज जो होती हैं वो बढ़ जाती हैं जिसकी वजह से मेंटल हेल्थ इश्यूज होते हैं 10-20%. Burnout, which is very important like in today's world, how do we manage the load and the intensity of training among athletes, this is very important. So burnout की वजह से 10% mental health बढ़ जाता है, plus it correlates with depressive and major depressive disorder. And आजकल आप देखते होंगे कि न्यूज में क्रिकेट खेलते हुए जिम में जाते हुए बहुत से न्यूज आती है दैट somebody had heart attack and died during exercise gym, or even in playing cricket में भी एक दो केस हुआ था, फुटबॉल में एक केस हुआ है. So all these are correlating to the not only physical but as well as psychological. So eating disorder बढ़ जाते हैं अगर आप प्रोफेशनल स्पोर्ट में हो, लाइक जिम्नास्टिक और एनी जिसमें वेट को आपको कंट्रोल करना है, उसमें ईटिंग डिसऑर्डर के चांसेस होते हैं. आयरन डेफिशिएंसी हो जाती है, इम्यूनोलॉजी सप्रेशन होता है, एंड डिप्रेशन 21.4 चांसेस बढ़ जाते हैं इफ यू आर एन एलीट एथलीट एंड आप उसमें प्रोफेशनल एथलीट हो आप. सो देयर आर सम वल्नरेबिलिटीज टू मेंटल हेल्थ illnesses in which social world of many organized athlete requires high investment time of energy, जिसमें एक आप एथलीट को अगर आप देखोगे तो उसकी पर्सनल ऑटोनॉमी कोई नहीं होती, जो कोच जो सिस्टम कहता है they have to follow, and sometime it is disempowered, this basically disempowered the athlete. And elite sport environment also has difficult environment like identity foreclosure. Athletes, elite athlete अगर sports like MS धोनी, अगर MS धोनी या विराट कोहली, अगर विराट कोहली ना हो, क्रिकेटर ना हो, उसके बाद क्या है वो? If they don't play, they don't get relate themselves to, they don't stay in cricket. I'm not talking about playing cricket, but in cricket related situations. उसके अलावा फिर हैं क्या? That is also important. So the identity frequently is tested in elite sport. Injury, competition failure, aging, retirement from sport, and other psychological stresses also contributes in depression or other disorders. And risk-taking behavior is also one of the reason people find themselves in bad mental health state. Then among young athletes also, जो अभी उभर के आ रहे हैं, उनके लिए भी बड़ी चीजें डिफिकल्ट हो जाती हैं जब बिकॉज दे हैव टू प्रेशर ऑफ लाइफ बैलेंस. लाइक I am from psychology background. So one thing I find very interesting and tough for the students of BPEd and BPS and MPS and MPEd, कि for them it becomes difficult to play the sport also, जो जिसमें वो like they have played their favorite game also, and उनके अलावा बाकी जो बहुत सारा प्रेशर होता है गेम सीखने का, क्लासेस का, other activities, so that becomes a lot of pressure for them also. And it is not only in physical education, I'm talking in general also. There is a difficult among students जिनको life work balance नहीं आता. And then the more people recognize you, the more people scrutinize you also. आप जितने बड़े एथलीट होंगे, जितने बड़े आप स्पोर्ट्स पर्सन होंगे, उतने ही लोग आपको स्क्रूटनी करेंगे, आपकी गलती पे आपको क्रिटिसाइज करेंगे. And sometime because of the athlete's status as a role model, it becomes difficult for them to handle it. उनको वो रोल मॉडल जो स्टेटस है उसको बना के रखने के लिए बड़ा एफर्ट करना पड़ता है. Then pressure to perform by coaches also is one of the reason. Then time constraint is also there, dealing with injury and career termination, mental and physical demands on in terms of intense training is also. So as a physical education teacher, आप अपने like students को कैसे बता सकते हो, जो या coaches जो बनने जा रहे हैं, आप उनको क्या चीजें बता सकते हो, basic behavior कैसे monitor करते हैं. So अगर आपका एथलीट या आप जो आपके स्टूडेंट्स हैं वो किसी एथलीट से डील कर रहे हैं, तो उनको कुछ पॉइंट्स हैं जो आप बता सकते हो दैट अगर ये आप चेंजेस देखते हो तो यू शुड like take note of that. So first thing is change in eating and sleeping habits. This is one of the most important aspect. If the athlete has difficult sleeping or he sleeps a lot or difficulty in eating, he eat less or more, you need to be very sure that it is not related to the training. अगर उस ट्रेनिंग से रिलेटेड नहीं है तो कहीं ना कहीं there is something which is mental health हो सकता है. Then unexpected weight gain and loss, drug alcohol use हो सकता है, withdrawal from social contact, किसी से बात नहीं करते एथलीट कई बार, not people who are always aloof, but I'm talking about people who are generally talkative, who are generally friendly, but they find it difficult to be in touch with athletes or any other social contact. Then talking about death or dying, then problem, concentration, focus, becoming more irritable, negative self-talk, feeling out of control, the mood swings, agitation, irritability you find in the athletes, and overuse, injury, and continual being injured. Sometimes overuse or injuries can happen because of overtraining, as well as the lack of concentration, which is basically the reason of you not being mentally healthy. Then कुछ कॉमन मेंटल डिसऑर्डर्स हैं, मैं उसके सिम्टम्स थोड़ा सा ब्रीफ में बताऊंगा कि कौन कौन से डिसऑर्डर्स जनरली हम देखते हैं, नॉट ओनली इन एथलीट्स बट इन जनरल पॉपुलेशन आल्सो. सो एंजाइटी डिसऑर्डर है, पैनिक डिसऑर्डर एंड फोबियाज हैं. सो एंजाइटी डिसऑर्डर इज बेसिकली फियर ऑफ अननोन. आप डर रहे हो, आपको ये नहीं पता कि किस वजह से मैं डर रहा हूँ. आपको एक अनजाना डर रहता है अंदर से, लाइक यू फील एंग्शियस एवरी टाइम विदाउट एनी रीजन, without any proper stimulus. Then panic is when the sudden surge of anxiety happens. छोटे से पीरियड में आपको बहुत ज्यादा एंजाइटी होती है तो यू फील पैनिक. And then phobias are generally those situations which are not dangerous as such, but you find it troublesome. लोगों को क्लस्ट्रोफोबिया होता है, वो भीड़ वाली जगह नहीं जा सकते. Generally it is not dangerous situation, but they find it troublesome. There are these are the some causes, like genetic predisposition is also there. You need to see that how their parent behave when they are pressurized. So अगर पेरेंट्स में कहीं ना कहीं या उनकी फैमिली में कोई ना कोई एंग्शियस रहा है या एंजाइटी डिसऑर्डर से रहा है, परेशान रहा है, तो देयर आर चांसेस दैट दे मे आल्सो बिकम this anxious. Then circumstances, which is state anxiety. Sometimes the situation is like that. The pressure of competition is so much that you find difficult to play. And then drugs is also there because of some drugs. People find they are suffering from anxiety, and life experience also. Bad life experience changes a lot. Your athletes change in job, losing somebody, all these things make you anxious. Then stress is also, you all know what stress means. Uh, there are some way of dealing with stress. Uh, in stress, stress is basically anything you are afraid of the situation which triggers you. The situation is stressful. That is why you are feeling the stress. You are stressed because of a reason. Not if you are stressed because of no reason, that becomes anxiety. This is the basic difference between these two. Then depression in children, which is now have become a very normal thing. 2% of children under 12 struggle with significant depression, which is a very big number for country India. And teenagers just see 5% of the teenagers are more depressed than others. These are the causes of depression: losing a loved one, illness, stress, family problem, school problem, and sometimes it is genetic also. Uh, Now, what is the difficulty in spotting it? Among children, it is also very important. So the young athletes who are coming to you, or or your students who may be dealing with these athletes, this is very important for them to understand that the kids are difficult. They are not capable of expressing their feelings. They often react to their mood into more physical way than others, and they are sad, they are withdrawn or tearful. Other may become hyperactivity and troublesome. The same, like if they are not feeling, they are in depression, they may become hyperactivity and troublesome. These symptoms, all these symptoms which I have shared with you, should last at least 3 to 4 weeks. And when they talk about suicide, please make sure that you take them seriously. Do not take anyone who talks about suicide less, lightly, because there are 3 stages in suicide. First is the thought. So why do you want to commit suicide becomes important. If the athlete says that because of this reason or that reason I want to commit suicide, you have to take it seriously. Then how do you want to commit suicide is become. So somebody says that I will jump from this place because I don't want to live. I will consume poison. I will uh, hang myself from the ceiling fan. So all these things, when the person says that, the way they are going to do it, when the person talks about it or the student talks about it or anyone around you talks about it, you need to take it seriously. And the timing, when somebody says that by this time I will, if that nothing changes, I will commit suicide, that means it's a very serious. You need to immediate take take them to an expert's advice. So there are bipolar disorders. Sometimes bipolar means when sometimes you are very depressive and sometimes you are overactive. In that also you can find see in athletes. Then these are the symptoms of bipolar disorder. When you are feeling of unhappiness that won't go away, you are depressed, agitation and restlessness, loss of confidence, and feeling useless, inadequate, or hopeless. In and in one, like after 2 3 weeks or 1 month, three after 2 months, you become elated, feeling more important than usual, full of energy or ideas. If you go to these two extremes, that means you have bipolar disorder. And eating disorders are very common in sports. So this PTSD is also important. Any athlete who suffers from injury, be it in sport or outside sport, there are chances that they become this for them. It becomes a very traumatic experience. And when you deal with children, like if the kids comes to you and share that because of the family they have family issues, and then you need to make sure that they are not having traumatic experiences. If so, there are chances that they may develop stress, this post traumatic stress disorder, which is stress lasts more than 6 months continuously. Then schizophrenia is one of the disorders. It's not very common, but it is. So if you see that out of 100 people, one person will be affected by this 15 to 35 year age. So schizophrenia is basically a disorder of perception. Your perception is distorted. So you may find yourself hallucinating. You may find something. Okay, for a schizophrenic person, the world becomes true in their imagination also. Like for their imagination, it is a true world, and they can talk to anybody. For them, the person is real. So this is also one disorder. You may have seen people with schizophrenia on streets. They don't clean themselves. The people who wear blankets in summers and not clean, and they talk to themselves. So this is one. And then personality disorder is one of the is also important. uh, in this I'll just in personality disorder, there is one disorder which I want to share is a borderline personality disorder. This is one of the most common disorder of personality, but it is not identified as easily as it is. It has symptoms, it have manic symptoms, it has anxious anxiety symptoms. So bipolar, this borderline personality disorder is also important for you to understand. Basically, it is a fear of abandonment. Fear that if somebody is with me, the person will abandon me, and you start clinging on them. You become toxic. You become you always try to make them sometime happy and make sometime hurt them. This is among kids also. And suicide is I have already shared the data of recent data of suicide of the shooters. And what are the treatments for that? Now, all these things we have talked about, that okay, this is the disorder, these are the disorder, people have also talked. Now what are the main treatments available for them? So one is talking therapies. Now those talking therapies can be group therapy, counseling, or psychotherapy, which makes helps remember events, make sense of them, and move on. So whenever we have counseling session, we generally talk about the incident, talk about the feelings which they are having about the incident. So all these things, when you put in front of them in a very systematic manner, that leads to healing. One Sigmund Freud gave one important therapy which is called free association. You call the athlete or patient and let him talk or her talk in any manner without any relation to the first sentence. The person talks and talks and talks. That gives them the feeling of catharsis. The catharsis is very important in this aspect. Then cognitive behavioral therapy also is very important. In this, generally what happens is you try to amend the cognitive thoughts which they have made concrete thoughts, and you try to change them. And then I'm movement desensitization and reprocessing, EMDR is also used for post-traumatic stress disorder. Some relaxation therapies are also there. Medicine is one of the most important aspect. So we need to understand as a teachers, as trainers also, that whenever you find somebody suffering clinical disorders, we need to take them to doctors, the psychiatrists, so that they can take medicine. So medicine becomes very important in these. Cognitive psychotherapies are also very important, but medicine is also very important. Now, these are some researches being done, and one of the research on by Gulliver et al. In 2012, they did it on barriers to mental health help seeking young athletes. That so there is a stigma, they worry what other things about them. So all these things we have already talked. Now, when we talk about the system, how do we help the athlete? There is a few models which I will be sharing with you. Is one, this is one, an ecological system model for an elite athlete mental health. So इसमें क्या है कि एथलीट के अपने भी कोपिंग स्किल्स हैं और उसका अपना एटीट्यूड है, उसके अलावा उसको और क्या हम सपोर्ट कर सकते हैं. इन दिस माइक्रो सिस्टम कम्स योर द कोचेस, टीचर्स, हाई परफॉर्मेंस स्टाफ, स्पोर्ट्स मेडिसिन स्टाफ, पेरेंट्स, फ्रेंड्स, ये सब मिलके उसके सपोर्ट करेंगे. एक ये हो गया. देन इकोसिस्टम. तो जैसे अभी मैंने एग्जांपल दी थी जो कर्माकर की, कि ही बेसिकली when he became the chief coach, he initiated the need of psychologist in the team of shooters. So एक particular team की, जैसे क्रिकेट में men के पास हमेशा से रहा है sports psychologist. If you go to other teams, now it is becoming a common norm, but सब sports में नहीं है. So the ecosystem which an individual sport can make, like क्रिकेट में होगा ही होगा. अगर आपने ट्रेनिंग करनी है या आपने कोचिंग करानी है, तो यू नीड टू हायर द sports psychologist, exercise physiologist, nutritionist, everyone for every sports. Then macro system, national sporting environment, public and social media. After 2020 Olympic, people have started talking about mental health, and all these people have come out and shared their experience, which becomes a normal thing. People now can easily talk about their feeling. Then how do you promote mental health? So you need to see that there is a prevention, treatment, and continue caring area in early intervention and then recovery. So early intervention, early intervention, you need to see people who are at risk. You need to identify those athletes or students who are at risk. Then people who are at high risk also. Then you need to find out people how do you identify their illnesses. Then you start with early treatment. You start psychotherapy first. If it doesn't work, then you go for standard treatment. Then after standard treatment, you go for self management. Then there is a chances that the person again will become depressed, so relapse treatment is there, and then rehabilitation is also there. And this is for all of the coaches, physical education teacher, even for us also. Like, I'm not a psychiatrist, I'm a psychologist. I cannot prescribe a medicine, so I have to understand my role as a psychologist also. So the best thing which the coaches or the teachers in physical education can do is, the athlete trusts you a lot. You are in a position of trust. You can use that position and guide the athlete or the student for in the right way, right direction. And maybe you may be the person whom they trust more. Like, I have experienced this in my field also. The athletes trust the coaches more than the psychologist or any other one. So it becomes imperative for the coach to become the mentor and guide for the athlete. And this there is an acronym in LG. This LG is basically assess for risk of suicide or harm. You need to listen non-judgmentally, give reassurance and information, encourage appropriate professional help, and encourage self-help and other support strategies. So this is very important for you as a physical education teacher, or maybe your students, for your students and the coaches also. So these are the references. Uh, Thank you so much. So now the session is open for any questions and queries.
Sir, thank you so much. Any question for the participants?
Anyone, please, if you want to share your own experience about this mental health topic also.
Sir, hello sir. Hello sir.
Ji Satyavan
Hello.
ji.
Today the psychology pressure regarding mobile problem is there, sir. Due to online mobile education, so many smartphone is there. So problem in school level, especially school level, high school levels, students not coming for the practice. They are regularly absent. So how is the solution for this?
Yes, this
They
is
are only
this is
on
a
online.
this has become a menace. This has, even for us also, like when just imagine, like for me it's difficult to teach without seeing the faces or the reaction of students. Still we are managing ourselves in this manner, and it's a very like comfortable situation for all of us that we sit at our home and we study and teach and everything. But this is a menace in the field of sports also. Like, you cannot separate athlete from the phone. That has become a problem in training also. So the athlete, like, it all becomes on the reason of why they play, why, what is the reason of them participating. It all becomes, so are they practicing just for the sake of practicing, or they want to become something. That has to be identified by you as a coach, as a teacher, that why they are not coming, what is the reason. That is my training style is not correct, or maybe there is something that they don't want to practice here, or they don't find it interesting. So we need to find out all the things. It's not only mobile only. Yes, there is a this is a menace that is very
Okay,
important
okay.
to identify.
Thank you, sir.
Please, I see a lot of senior people here, so if anyone want to share and enlighten us on their take on this mental health issues in sport, आप अपना कोई विचार शेयर करना चाहते हैं अबाउट मेंटल हेल्थ. आप, मैं काफी सीनियर्स हैं, आप देख रहा हूँ यहाँ पे, एंड आई एम प्रिविलेज्ड कि मैं आपके साथ अपना एक्सपीरियंस शेयर कर पा रहा हूँ, अपनी नॉलेज शेयर कर पा रहा हूँ। तो आप अपना प्लीज अगर आपको करना चाहते हैं, बिकॉज मे बी मेरे लिए भी कुछ लर्निंग हो जाए।
कुलदीप सर,
जी 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 सतीश जी।
सर अभी आपने कोट किया था उसमें विनेश के और हमारे जो इंडियन इंटरनेशनल प्लेयर को, सानिया मिर्जा को और इनको, और अभी आपने कोट किया था तो पीछे भी हमारे जो स्पोर्ट्स पर्सन है वो दिल्ली बैठे थे जंतर मंतर उस पे धरने पर।
जी जी जी।
वो वही बात आपने कही थी, अगर कोई कहता है तो फेडरेशन और उनको फिर अपने अगेंस्ट लेते हैं, फिर वो कहे तो किसको कहे, यही बात हो गई ना। वो फिर उसको,
तो
अगर सानिया मिर्जा कहती है तो उसको फिर धर्म पे ले जाते हैं हम, अगर कोई और
जी
कहता है तो कास्ट पे ले जाते हैं, कास्ट पे ले जाते हैं, फिर कास्ट में भी सब कास्ट ले आते हैं। अब उसको कहे कैसे, वही तो डिप्रेशन पैदा करते हैं।
yes yes this is very important, this is very important point that when we what is the, like if we share with like this Vinesh example, now they are sitting, they were sitting on Jantar Mantar due to reason, so now they have been called कि because they are from Haryana अभी यूपी dominate कर रहा है in the operation, बहुत से अलग रीजन निकाल दिए, बट दिस वाज स्टार्टेड व्हेन शी वाज इन टोक्यो में उसने रिबेल किया, उसके बाद से ये सारा सिलसिला चला है। सो दैट इज व्हाट, जो मॉडल मैंने शेयर किया था कि एक हमारा जो सिस्टम है, लाइक इट्स नॉट ओनली द एथलीट, द एक्सो सिस्टम इज आल्सो नीड्स टू बी चेंज। द एथलीट is one part, the coaches are one part, teachers are one part, the whole aspect of like the ecosystem of sport in terms of the federations, in terms of training centers, all these things has to change. So ये सारी चीजें जब तक बदलेंगे नहीं तब तक मुश्किल रहेगा हमारे लिए ये कहना कि नहीं हाँ बोल दो आराम से कोई बात नहीं। दिस इज अ डिफिकल्टी, बट शायद हम इसी चीज को दूर करने के लिए बात कर रहे हैं आज। एंड आई एम श्योर दैट बाय लाइक यू मे फाइंड इट लिटिल बिट मोर इंफॉर्मेटिव देन द नॉलेज यू may share your, like your perception changes, so now you allow the students, so few of you may become in a prominent position, so you may change the, like uh, Karmakar has done it. So this is what I assume when we talk about the experience, the ecosystem, the ecosystem we require.
थैंक यू सर।
और कोई क्वेश्चन, एनी अदर क्वेश्चन?
हेलो सर।
जी जी प्लीज।
हेलो सर। सर आजकल हम देख रहे हैं कि जो स्पोर्ट्स साइकोलॉजिस्ट का रोल है वो बहुत ही इम्पोर्टेंट है, और जहाँ तक हमारे इंडिया की बात है हम देखते हैं कि सिर्फ नेशनल और इंटरनेशनल में एक स्पोर्ट्स साइकोलॉजिस्ट टीम के साथ रहता है, और अगर हम बात करें इंटर कॉलेजिएट या इंटर यूनिवर्सिटी की, हमको ऐसा कोई आदमी नहीं दिखा देता जो कि स्पोर्ट्स साइकोलॉजिस्ट टीम के साथ है। तो सर आपको क्या लगता है कि ऐसा होना चाहिए, जो इंटर कॉलेजिएट या इंटर यूनिवर्सिटी की टीम के साथ भी कोई स्पोर्ट्स साइकोलॉजिस्ट होना चाहिए क्या?
जी जी, एथलीट को जब तक आप लाइक एक पहले टाइम पे एक स्टेटमेंट चलती थी, कैच देम यंग, वी आर कैचिंग देम यंग, वी आर नॉट गिविंग देम प्रॉपर ट्रेनिंग इन द सेंस ऑफ कंप्लीट ट्रेनिंग। कंप्लीट अभी साइंटिफिक ट्रेनिंग का जमाना है, तो इट इंक्लूड्स एवरीवन, नॉट ओनली स्पोर्ट्स साइकोलॉजिस्ट बट फिजियोलॉजिस्ट, बायोमैकेनिक्स, न्यूट्रिशनिस्ट, डॉक्टर, एवरी कंडीशनिंग अभी तो स्पेशलाइज्ड हो गए हैं। लाइक इट्स इम्पोर्टेंट टू अंडरस्टैंड दैट एवरीवन is important when it comes to a performance of an athlete. I am very happy to share with you all that I am in Manipur, and there is a boxing academy here. I am basically from boxing, so there is a boxing academy in Manipur, Imphal, Mary Com's boxing academy. वहां पे they have like all level athletes, so बच्चे छोटे भी हैं स्कूल में जाने वाले जो सब जूनियर लेवल पे हैं, कोई जूनियर लेवल पे हैं, then some of them are elite level athletes. They have hired a sports psychologist.
Yeah.
So things are changing in future. 2014 के बाद there is a shift in साई also. आप साई में भी देखोगे तो वहां पे भी स्पोर्ट्स साइकोलॉजिस्ट अवेलेबल होने लगे हैं. बट यस, वी नीड ऑन ग्राउंड. जैसे like what we have started doing it in Manipur and in our department especially, that we have now 6 o'clock जो assembly होती है, the psychology student will attend. They will go to ground, they will choose some sport and play so that they can become familiar with the sports also, and the athletes becomes familiar with them. आप जब ground पे होगे, from the bottom, like from the kids you need to start. If you give good training to the kids, they become mentally strong by the time they become elite athlete.
Right, sir.
And I think in future, like the quality problem is in India was earlier कि quality of sports psychologist बहुत कम है सर. इंडिया में जो कोर्सेज नहीं थे, अभी रिसेंटली स्टार्ट हुए हैं. Then with the time, people have realized the importance of sports psychology also. Now they are even personally hire भी कर रहे हैं लोग अपने अपनी टीम के साथ, अपने अपने, like IPL has started hiring, and it will definitely, if we produce quality psychologists, we will definitely get
संदीप का फोन आ गया होगा. जो लिस्ट बनाई थी ना एससी वाले बच्चों की, वो निकाल दे, कल लास्ट डेट है.
Thank you, sir.
डॉक्टर मीनू,
आपके पास है ड्राइंग टीम?
ना सर, मेरे पास.
डॉक्टर मीनू,
डॉक्टर मीनू प्लीज, डॉक्टर मीनू आप म्यूट कर दे प्लीज.
जी जी. So any other point of view or any other query somebody wants to ask?
Thank you, sir. Heartiest thanks to our speaker, Dr. Kuldeep, for such interactive session. This session was very informative as it was focused on various psychological aspects related to sports. Thank you, Dr. Kuldeep.
Thank you, Dr. Mukesh. Thank you so much.
Thank you, sir. Good information.
Thank you.
मुकेश सर, फीडबैक लिंक.
ओके सर, ओके. मैं आपको शेयर करवा दूंगा आप व्हाट्सएप ग्रुप पे फीडबैक लिंक और
शेयर
अटेंडेंस
सर,
लिंक दोनों.
सुनो सर, प्रॉब्लम है क्योंकि कॉल आ जाती, कॉल आने के बाद जो हमारी ये होती है ना मैसेज की, खत्म हो जाती हैं.
ओके,
तो व्हाट्सएप पर आ जाए तो बढ़िया है, नहीं तो इसी पर आप करवा दो, अभी तो हम भर देंगे फीडबैक.
नहीं व्हाट्सएप ग्रुप के ऊपर करवा दूंगा मैं, जैसे ही आता है तो व्हाट्सएप ग्रुप पे करवा
नहीं,
दूंगा.
यहाँ
ठीक है?
चैट पे भी करवाना चाहो तो यहाँ करवा दो, क्योंकि सर अगर कॉल आ गई ना तो जो चैट होती है वो खत्म हो जाती है कॉल आती ही.
या राइट. ठीक है, बट अभी
ग्रुप पे ठीक रहेगा, उसी पे करवा दो सर, व्हाट्सएप ग्रुप पे.
व्हाट्सएप ग्रुप पे करवा देते हैं.
हाँ, पहले भी बोला था सर कि आप दोनों लिंक है ना व्हाट्सएप ग्रुप पर, टाइमिंग चाहे आप 10 मिनट ही रखो, लेकिन यहाँ तो कॉल तो जरूर आएगी फोन पर किसी न किसी की, कॉलेज में आती रहती तो चैट खत्म हो जाती है.
जी ठीक बोल रहे हैं आप पुरुषोत्तम सर. बट अभी योगेश सर एक मीटिंग में है, तो वो जैसे ही आते हैं ना तो मैं उनसे डिस्कस कर लेता हूँ. और अभी जो इसका लिंक अटेंडेंस का और फीडबैक रहेगा वो व्हाट्सएप ग्रुप पे शेयर कर दिया जाएगा. ओके, और अभी हम सब मिलेंगे आफ्टर लंच 2 PM. ओके, थैंक यू सो मच.
ओके,
Thank you.